The following portion of Daytime Blue Ridge is sponsored by
our Olympic athletes are going for their goals in Rio. The patients here at Blue Ridge Therapy Connection are also reaching for their goals to go home after a hospitalization. And one of the people that helps them do that is Amy Sartoris. Thank you so much for joining me,
It's
Amy.
my pleasure.
Tell me a little bit about the therapy and the techniques you use to help your patients achieve their goals.
Sure. Well, we like to start with the end in mind. So each patient that arrives at Blue Ridge Therapy Connection has a goal, generally to return home to their prior level of function. Once we can assess what that prior level of function was, then we can begin our treatment process. So the treatment process starts with a comprehensive evaluation of that patient and their family situation. Where do they need to go when they leave? What activities do they need to be able to do in order to go home safely? And then instead of treating the symptoms, we like to start with the cause. So if someone has problems with walking and balance, we're going to be assessing them for balance and gait, as well as strength, and individually breaking down that patient into different muscle groups and strategies based on their weaknesses in order to improve them.
Okay.
We also look at a comprehensive treatment approach. So we have all disciplines available. We have physical therapy, which is myself, occupational therapy. Occupational therapy also addresses things with the upper extremities and dressing and grooming so that they can go home and they can take care of themselves without someone needing to come into the home. We also have speech-language pathology. Following a stroke, a lot of times a patient may have some difficulty with their speech and facial expression, and our speech-language pathologist can help with that.
So if somebody comes here, they can either come here and visit each day and then go home, or do they have to stay here during their whole entire
That's a great
therapy?
question. We actually have several options available. We like to be a comprehensive care provider. So when you talk about that, we look at people can come here and stay following their initial hospitalization for rehabilitation. Once they get to a level that they feel comfortable going home, we will discharge. Once they're at home, if they need some additional help before they feel comfortable coming back out into the community, we do have home health therapy services available. So we can provide our same staff to go out into the field to see them for home health care, which includes physical, occupational, and speech therapy. And then following discharge from home health, if they still need additional services, they can come and visit us on a daily basis, on an outpatient basis, where they come in for an hour, receive their therapy, and then return to home. So that comprehensive care model is something that is unique to our facility. And we also see that the community has embraced it and that people like to have their same therapist follow them throughout their care.
Nice. And if people want more information, how do they find you?
One of the ways to reach us is on the internet at thelandmarkgroupllc.com. They can also contact us directly here at the Blue Ridge Therapy Connection at 276-694-7161.
Amy, thank you so much.
Thank you.